Hello everyone. Today we are going to take a very important topic, which is planning and evaluation, which forms the basis of public health decision making and policy making. So what exactly is planning? First, you think about a plan. When do you make a plan? When you are about to take an action. So it is a blueprint which you make in your mind or you write it down so that you can take a course of action. So planning is a systematic approach. Firstly, you will define the problem. You will see what your priorities are, develop the specific goals and objectives, and then you will determine alternative strategies and how would you implement that plan. So our purpose of planning is very simple. First, in reality, we always have limited resources. So we want to see that our resources fit in with the solution of the problem. Second, we want to eliminate any wasteful expenditure which is happening. We want to develop the best course of action that we can to solve that problem. And lastly, to improve the health services, for example, in our case. So when we talk about planning, in very broad sense, we can say that it has 3 steps, which is formulation of the plan, execution of that plan, and then evaluating the plan. So Spiegel et al. Gave various methods of planning. Firstly was problem solving planning. So from the name itself, first you will identify the problem and you will try to resolve it. So let's say, for example, fluorosis is a problem in a community. So if we are planning to solve the problem of fluorosis, that is problem solving planning. Then you have program planning. So in this, you will undertake a health program to solve that problem. So for example, your school oral health programs, fluoride mouth rinse programs. Next, you have coordination of efforts and activities. Now here, you are coordinating various sectors to achieve effectiveness in your solutions. So for example, if I find that there is an area with a really high amount of caries, I will set up my dental clinic in that area as opposed to some another area where dental disease is not an issue. Then we come on to planning for the allocation of resources. So as I told you, in reality, our resources are always limited. So we, while planning, should allocate the resources to the problem which has the highest priority. So for example, in a community where pit and fissure caries is a problem rather than smooth surface caries, so I will replace the fluoride rinse program with a pit and fissure sealant program. That will be a better effective use of my resources. Then it talks about creation of a plan. So basically, you make a proposal or a blueprint of sorts so that you can undertake the actions in a proper manner. Now for this step, we usually make a task force. Now what is a task force? So a task force is a temporary group of people who have come together and are of various disciplines. So a multidisciplinary approach can be achieved to think about solutions for a given problem or a given project or a mission. Then lastly, designing standard operating procedures. So this is something very commonly done. We call this as SOPs, standard operating procedures. So they are standards of practice. For example, if you want to open up your tobacco cessation clinic, you will have to make your SOPs. So the patient will come in here, first I will do an oral examination, or first I'll take a medical history, then a tobacco history, then I'll do an oral examination, then I'll refer to maybe a oral medicine specialist, etc. So these are SOPs. So now this is very, very, very important. This entire chapter is about these steps. So whenever you will get a question in planning, it will be most probably from steps in planning. So let's understand what the steps are. Firstly, you will identify the problem, right? Obviously, when you are solving an issue, you will identify the problem. For this, you will do 3 steps: conduct a needs assessment, collect the data, then analyze the data. After you've done that, now you will determine the priorities out of all the data you have collected. Now you have seen what your priorities are. Now you can go ahead and develop your goals, objectives, and activities. Now after that, you will have to do 3 steps to see what are your resources, what are your constraints, and you should always have a plan B, which are your alternative strategies. Now, given all of these 3 steps, you will develop your implementation strategy. How will you implement your program, for example? Then, finally, you will implement, but this doesn't end at this. You will monitor your program, then you will evaluate it, and then revise. And this keeps on going. Because continuously, if your program is running, you will keep on monitoring it, evaluating it, finding problem solutions, and revising it again and again. So that's why we say planning is a cycle instead of a straight flow of events. That means it is dynamic in nature. So let's understand these steps in detail. So let's discuss about the first step, which is identifying the problem. So under this, we'll do 3 steps. First, we'll conduct a needs assessment, then we'll collect the data, and then we will analyze this data. So let's understand this in detail. So as I told you, we do something called as needs assessment. So from the name itself, you can understand we are looking at the needs of the population. For example, if I am conducting a survey in a village, I will see what is the prevalence of all the dental diseases and which is at the highest prevalence, so that I can understand the needs of the community. Not only this, we also see what are the opinions of the community members, the community leaders. Maybe, for example, I find out that caries is a very high problem in that area, but the water is high in fluoride. So maybe fluorosis is also a concern for them. So basically, why do we do this needs assessment, or something that we call as situation analysis? Is to see what is the problem, what is the cause of the problem, what is the extent and severity of that problem, and to see the effectiveness of the program that we would run, and we would also obtain the profile of the community. For example, the socio-economic status and what is the education status, etc. So why are we collecting all of this data? Basically, we want to develop very appropriate goals and objectives for our program, right? And this will also help us in our health promotion needs. So some typical data that we collect during needs assessment is given. So firstly, the socio-demographic profile, right? For example, your age, what is the socio-economic status, what is the ethnicity, then the disease levels. So here you will see what is the epidemiological data, what is the condition, what is the severity of that disease, what is the distribution, and what are the trends. And when we will also see what is the existing condition of the dental services in that area. So are the dental services readily available? Are the treatments available? What are the costs of that care? That means affordability of dental care. What is the geographic location of the services? That means accessibility of that care. This was affordability. And what is the effectiveness of interventions? Then we will also look at the public concern. So we can interview, if you're the Gram Panchayat head, so we can understand what are the population priorities. What do they think is a problem in their community? What are their views of the dental health services in the area? So for this, we will do the collection of data. Now, as I told you, one very famous method is conducting a survey. So you can conduct surveys, you can even do clinical examinations, interviews, focus group discussions. So focus group discussion is when a group of 8 to 12 people sit down and, give a qualitative explanation of their problems, investigative reports, and we can even look at the previous researchers. Now we will analyze this data. So when we are analyzing this data, we need to think about certain things. For example, we need to firstly think about the socio-economic structure of the community. Then we will also do a population breakdown. So under this, very important, we should consider the cultural barriers, maybe the linguistic barriers. We will also look at the age distribution so that we can correctly identify our target groups. For example, if I go in a village, I do not look at the age groups and collect data for dental caries. But later on, I realized that dental caries was an issue in the age group of 6 to 12-year-olds. So my targeted program would have been fluoride mouth rinse program in that case. So, but I did a treatment program. So my program will not be that effective as compared to a fluoride program. Then we will also look at the educational status of the community, because this is very important for our health promotion and education, because I will be teaching them about oral health. So I need to understand their literacy levels. So will they be able to understand my message? Then what are the types of employment? So this is very important in the case of occupational diseases, right? So if in an area most people are factory workers, then we can understand what problems they will be facing. Then other things that you can look at are transportation system, so that you can establish, for example, I want to establish a mobile dental van in a village. So I need to know what are the transportation routes. Then what are the local government policies? For example, in a village, it is not allowed that a dentist goes around in various houses and conducts a household survey. You need to obtain certain permissions. So you need to look at the government laws, regulations, and barriers. Then you also need to look at healthcare facilities, what is the level of fluoride, etc. So the next step, after we have done a needs assessment and we are now also analyzed the data. Now I will get a list of various diseases which are prevalent in the community. Now I need to understand which problem will be at the utmost priority. So you will make a list. This will be my first priority, this will be my second priority. So let's understand this step. So priority determination is nothing but a method of imposing people's values and judgment of what is important onto raw data. Now, if I am determining the priorities for a community, I will impose my subjective opinions on it. So now it is very important because resources are always limited and we need to establish the priorities. And if we do not do this step properly, we may not be able to serve those who are at the highest need. So for this also, we will create a health task force or an advisory committee. So now this committee usually is formed by the consumers being the population, then the community leaders and providers, and together they come up to see what is their actual priority. So now after this, we have a third step, which is to develop the program goals, objectives, and activities. So now what exactly is a goal? Now goal is always a broad statement, remember. When we talk, goal is an overarching umbrella, right? It is the overall purpose. So for example, to improve the oral health of the school-age children in the community. Now under this umbrella, you will have various objectives. Objective 1, objective 2, objective 3. Now these objectives, they are more specific in nature and they are more measurable. So for example, my goal was to improve the oral health of the school-age children, right? So under this, my first objective will be to reduce the prevalence of dental caries by 33%. Second, to improve the oral hygiene index, OHI, by let's say maybe 20%, and so on and so forth. So now when we are talking about goals and objectives, we should always include our target population and what is our statement of priorities, right? These are usually expressed in terms of dental indices or dental indicators. For example, maybe DMFT, or in the form of non-dental indicators. For example, availability. that there should be a 10% increase in the availability of dental health services. So program objectives are of two types. First, you have your process objectives, right? So basically, these objectives are regarding how will you achieve your objective. So how will you reduce that problem? Outcome objectives are to quantitatively measure the outcome. As I told you, reducing the prevalence of caries by 33%. So that is an outcome objective. As I told you, the objectives should be specific and they should cover all of these points. So let's understand it by an example. For example, my objective will start like this: to reduce, what is the nature of the situation? Dental caries. The extent of the condition to be attained, let's say 33% reduction. So to reduce dental caries by 33%, who particular group which is most effective? So let's say 6 to 12-year-olds are most affected by the condition. So to reduce dental caries by 33% in 6 to 12-year-old children, where the geographic area of the program, for example, in Bareilly, Uttar Pradesh, and by which date? By 2030. So this is how you make your objectives. So now, when we talk about objectives, we should also keep in mind a principle called as SMART. So the objective should be SMART. That means specific, measurable, appropriate, realistic, time-bound. It is the one and the same thing as we told that the objective should be specific. That means they should be focused on one problem area. They should be measurable. For example, 33% in the previous example. They should be appropriate to the needs of the population. Then they should be realistic. That means it should be achievable. I cannot say I will reduce the caries by 80%. I know that is not achievable by 2030. Then time bound. So the date at which you want to achieve the goals. So now you have made your program objectives and goals. Our next 3 steps are to identify the resources, then to identify the constraints or barriers, and lastly to identify the alternative strategies. So firstly, let's talk about resource identification. Whenever you're talking about resources, remember it is always MMT. It is money, material or manpower and time, triple MT. But now it has been modified. We have put the new mnemonic is MMMTSK. So money, manpower, material, time, and along with this we also need knowledge, skills, and T stands for technology. So after you have identified all of these resources, for example, in manpower, how many dentists are available in that village? How many dental hygienists will be available? Then money, what is the cost for the program and how much I can afford? What is the knowledge and skills of the dental professionals in that area that I can employ? When you have identified all of these resources, you will be able to understand and implement the program accordingly. So another thing that you have to keep in mind while resource identification is these 4 criteria. Firstly, they should be appropriate, they should be adequate, effective, and efficient. So appropriate means the most suitable resources for that job, right? So if my job is to run a dental unit in a primary health center, I will employ a dental surgeon. I need not employ maybe, let's say, a specialist, a oral and maxillofacial surgeon. Maybe that is enough for me. Adequacy, again, it should be adequate to complete the job. Then effectiveness means that the resources should be capable to complete the job. That means fulfill our objectives, right? If there is a lot of problem of caries in that community, I need to make sure that I have enough restorative material, restorative instruments in the dental clinic I have set up at that PHC. Then efficiency also. So efficiency is nothing, it is basically output by input. So you always want to maximize your output and minimize your input. So this is when you achieve efficiency. So now next is to identify constraints. Now every plan has some barriers and we have to address it. So the constraints typically in our health setup, they may result from organizational policies, right? So for example, in India, I have seen that the youth is getting influenced to consume nicotine devices because of Instagram and YouTube. But there are no laws in our country to stop them from doing it. So that is a barrier for me to stop the youth from smoking. Then next, what are the resource limitations? So I always have limited resources. So if I think that I will set up a big hospital, but I haven't been given enough funds, I won't be able to achieve my plan and achieve my goals and objectives. And then what are the characteristics of the community? Maybe cultural barriers, some taboos, myths, etc. Now, it is very important that you identify the constraints early in the planning stages. Why? Because then you can modify your plan according to it. Once you have implemented your plan, then revising it and doing it from the start, from the scratch, is very difficult. So it is said that best way to identify constraints is to bring together a group of concerned citizens who might be involved or affected by the problem. So you have to see those people come together who are familiar with the local politics, the community structure, what are their, who can identify the constraints and who can identify the alternative strategies. So some examples are, for example, there is a lack of fluoride policy in an area. So that could be a constraint for me. Low priority is given to oral health. I'll face a lot of issues setting up an oral health clinic. Then socio-cultural barriers, financial barriers, manpower limitations. Now, it is very certain that your plan A might not work. So you should always have your plan B ready. And you should always have a sufficient number of alternatives. Not only plan B, you should have C, D, E, F, multiple plans ready. Why? So that at least one of them will be effective. Or implementable, right? You will also have to look at each of the alternative strategies in terms of what are their costs, what are the effectiveness, what is their feasibility in terms of technical, social, political, and financial matters. So these alternative strategies are usually made in the planning process. So for example, I go to a village and I do a survey, and I find out during that survey that there is a issue of geographic accessibility issue. So this is the village. There is a hospital in the periphery of that village. There is an accessibility issue for majority of the village. So I will now, during my survey, also collect the data for what are the transportation routes in that village, so that maybe I can set up a mobile dental clinic or give transportation facilities for my clinic. So now once you have identified your constraints, for example, now you can either modify your plan or let's say overcome the constraints. If you cannot overcome the constraints, then you will have to resort to either modifying your plan or let's say maybe developing an alternative plan. So now it is always said that you should generate a sufficient number of alternatives. We say, right, if you have a plan A, always have a plan B. But in this case, you should have a plan C, D, E, etc. Now, why do we generate number of alternatives? So that at least one of them will be effective or will be implementable. And all of these alternative strategies are plans themselves. So when you are making these strategy, you have to examine the cost, the effectiveness, what is the feasibility in technical, social, political, and financial matters. So let's consider an example. If there is a village and I have set up my hospital in the periphery of that village without considering any geographic considerations, I had set up this hospital. I now find out that the people can't come to my hospital only. So that's why during the needs assessment time, I told you that you should also look at the transportation routes in that village. So now after I've set up, now I will have to overcome these constraints. How will I do that? Now maybe let's say I will set up a mobile dental van which will go across the village and provide dental services. So now we have done all of these steps. Our next step would be to develop your implementation strategy. So before implementation, you have to make a detailed, rules, your statements of procedures to implement your strategy. So how do you do that? You have to consider all of these aspects, like what is the effect of the objective to be achieved? What are the activities required to achieve that objective? For example, if my objective was to reduce dental caries by 33% in children, my set of activities would include fluoride mouth rinse programs. It will also include school oral health programs, training of teachers, coordinating with school for various activities, and providing appropriate nutrition through midday meal schemes, oral health education, brushing demonstrations, etc. So now you also, in your implementation strategies, will list out all the activities you want to do. You will now also see which all individuals will be responsible for these activities. So for training of teachers, maybe a dentist will go. For the school oral health program, maybe a nurse is sufficient. For fluoride mouth rinse program, a dental hygienist, etc. You will also see the chronological sequence of all of these activities and what is the cost estimate of money, manpower, time, etc. So our implementation strategy should answer all of these questions similarly to our objective: why, what, who, when, how, and how much. So after we've made our strategy, our next step is but obvious, we want to implement it. But along with implementation, we want to do monitoring and evaluation as well. So implementation is nothing but process of putting your plan into action, right? And it is an ongoing process. You have to continuously do it. When we talk about our implementation process, you have 4 phases. First is pilot phase, then is controlled phase, then actualization phase, and last is the operational phase. Let's understand these phases. In the pilot phase, so pilot is something which is done before the main thing, right? It's not actually your plan, but something where you are testing out the waters. So in the pilot phase, you will see the program will be done on a trial and error basis. Then you will go on in a controlled manner. So controlled manner is when you have regulated conditions. Everything is as per expected. Then actualization phase. Now you will expose your program to realistic operating conditions. And finally, in the operational phase, the program will become an ongoing part of the structure. It will continuously go on and run. And if it runs on smoothly with monitoring and evaluation, it will become smoother as it goes on. So you have to keep certain rules of implementation in mind. You should know when each step will begin and when it will end. You will also, arrange all of these things with the organizations. For example, you have to sign a MOU with the NGO. You have to do it during this process. You have to specify what resources are needed and what are their sources. You have to also see what constraints must be addressed and make sure all the people who are involved in the plan know about it. This is very, very important. So after our implementation, we will monitor and evaluate our program. So these are two different processes. Monitoring is a day-to-day activity that you do to report the activities of that organization. For example, I've set up my dental hospital. I am the head of that hospital. So I will make sure every day to see what are my staff doing? Are they completing the objectives? What was the OPD number today? What were the restorations given today? How many extractions were done in a day? Was the equipment working or not? You do that in your clinic. I'm very sure. For example, is my dental chair working? Oh, the water pipe has broken, etc. And how appropriate are the facilities? Do you have all the consumable items? Have they finished up? All of these things. But evaluation is more long term. So evaluation measures the degree to which the objectives and targets are achieved, or what are the results obtained. So here you will look at it from a long term perspective. So maybe I'm doing evaluation after 1 year of the project. So what was the progress in the past 1 year? We did a fluoride mouth rinse program and an oral health promotion program in school. Were the objectives achieved after 1 year? Were there any problems in carrying out the activities in the past 1 year? What do we need to do to revise and modify our plan? And how much money have I spent in the past 1 year, so that I can project what is the next amount of money I need for maybe next 10 years, etc. So when we talk about evaluation, you have certain steps. Firstly, you have to determine what is to be evaluated, right? Establish standards and criteria to measure it. So for example, in my program, I understood that I need to look at the cost, the manpower, the number of patients treated, number of preventive procedures I did, what are the oral health education sessions I did. So I need to know this. And to measure these, I need to have some standards and criteria, right? So for example, if I wanted to see how many restorations I have done, so maybe I will also look at the DMF of all of the patients to see if the decayed component is getting low, the filled component is getting high, etc. Then you will plan the methodology which will be applied for your evaluation. Then you will gather that information and analyze your results. So there are 4 criteria given by WHO which is used in the evaluation of dental services. First is efficiency. As I told you, efficiency is nothing but output divided by input. So our input will be your resources that you've put up, money, manpower, material, time, and your output, whatever you have stated, for example, reduction in caries, etc. So the ratio should be higher, the output should be greater than your input. Then you will also look at effectiveness. Now effectiveness is efficiency in real world conditions, right? So you will see that have the objectives been achieved. Looking at the resources I have put in, the activities that we have done. Let's say I have spent 1 crore rupees on a project and I have done multiple activities, but there has been no result. no reduction caries, no improvement in the oral hygiene status of the community, then my program was not effective. Then adequacy. So if I wanted to target the 6 to 12-year-old children, has my program, my activities actually targeted them, right? Opening up a clinic where 6 to 12-year-old children have severe caries might not be sufficient. I may be targeting the adult population more. I need to set up a school oral health program for that. Then appropriateness. So basically acceptability of the program. So was my program acceptable to the consumers? That means the people. Are the priorities being reflected in my program? Are my aims, objectives, strategies in alignment with the needs of the population? So when we talk about our evaluation procedure, they are broadly of two types. Your formative evaluation and your summative evaluation. Formative you can understand in the forming processes of the plan, right? So basically when the plan is ongoing, when it is being implemented. So under this you have your relevance evaluation, implementation evaluation and process evaluation. So summative is when you are done with the program and at the end of it you are doing it. Summative. So at this point of time, we will look at what were the outcomes through outcome evaluation, what was the impact on the population, impact evaluation, and the cost effectiveness and cost benefit analysis, which you will study in your health economics chapter. So you have some other types of evaluation also, which is effectiveness evaluation and your efficiency evaluation. So formative, during the earlier stages of the program, firstly we do relevance evaluation. So during our needs assessment time, so I need to see whether the program is needed or not, right? So during that time, let's say I have gotten a fund from Ministry of Health and Family Welfare to do a fluorosis prevention program in an area. But I do a survey and find that the fluoride levels in the water were normal and fluorosis is not an issue. So when at that point only, I can do a relevance evaluation and I will find that my program is not relevant for that community. Then the process evaluation. So the activities which were done, the efforts which were made during the program implementation should be in align with the program plan. That means if in my plan I had listed out that A, B, C activities need to be done by 2025 and under a budget of 6 lakh rupees, and actually during that process they did not do the ABC activities, instead they maybe did C, D, E activities and they completed this by 2026 and spent 10 lakh rupees. If this is happening, then during that process evaluation, I will change things moving forward. So you basically do this continuously when the program is being run, or maybe as a one-time assessment, maybe every 6 months, you will collect the reports from your staff. Then let's come on to summative evaluation, which is done at later stages. So when your program is nearing its end, so you will do an outcome evaluation. So if my outcome was 33% reduction in caries, has my program achieved that? Let's say I had a short-term goal by 2025 to reduce caries by 10% and by 2030 by 33%. So were my short-term, medium-term goals also met? And after all of this is done, we will also look at the impact. Now, outcome is mostly quantitative and measurable. So what are the effects, long-term effects after your program is ended? So for example, we are looking at the changes in attitudes and behaviors of the members of that village towards oral health. Are the myths and taboos vanished from the community? So these are the impacts on the population. So now let's talk about effectiveness and efficiency evaluation. So effectiveness evaluation, effectiveness is defined as ratio between the achievement of the program activity and the desired level which during the planning process the planners had proposed would result from the program. So basically nothing. What were the actual results divided by the expected results. This is your effectiveness evaluation. So basically you are looking at the immediate outcomes at that time. You are also seeing are the resources being effectively utilized to achieve the given effectiveness, right? Now, when you are talking about effectiveness, you have to see three variables. Firstly, you need to also evaluate the objectives. Secondly, the activities, and thirdly, the resources. So let's consider an example. When I'm running a hospital and I'm doing an effectiveness evaluation of that hospital, I will see what was the percentage of bed occupancy, what was the cost per day in that hospital, what is the cost per patient treated, etc. And how many patients were treated as compared to the cost per patient treated, etc. So next, let's talk about efficiency evaluation. As I told you, efficiency is nothing but output divided by input. So basically, the output with this level of input, this is output 1, and output 2 with this level of input. So basically, your minimum input. So for example, with 5 lakh rupees, I could achieve, a good fluoride mouth rinse program in a school. But I had actually spent 10 lakh rupees. But my output was same in both the scenarios. Then I have not achieved efficiency. I should have spent only 6 lakh rupees to achieve that objective. So it basically wants to relate the results and the cost of the program. That's how you achieve efficiency. So basically the results and your benefits and the costs. So this is all with the topic. Now planning is a very important aspect in this chapter. You can get a long question on planning, which will be with an applied aspect. For example, you will be given a problem statement in a community and you will be told to plan for a certain program in that community. You can get a long question on steps in planning to, tell them in detail. You can get a short note on evaluation as well. So thank you for listening. I hope you understood this topic really well and try to apply it practically when learning.